I like to call this lecture When Bad Things Happen to Good Cells. We're going to talk about the mechanisms of cell injury, the body's response to it, which inflammation is a big part of it, and healing. Then, how do the cells recover, or do the cells recover? So, the learning objectives for this chapter, we want to be able to discuss the mechanisms of cell injury and the process involved in reversible and irreversible cell injury, some of the different causes. We want to see the pathophysiology, signs, symptoms, stages, and complications of acute and chronic inflammation, and the types of healing and factors that affect healing and the complications of healing. So that's over the course of the next four, hopefully short, lectures. So in part one, this is part one, we're going to talk about cell injury and death. So cells can be injured and there can be reversible damage where the cells recover or irreversible damage where the cells die. And when they die, it's called necrosis. And we're going to talk about the different types of necrosis. And then we're going to talk about another process which is different from necrosis by which cells die, which is called apoptosis, or as some people pronounce it, apoptosis, because they say ptosis is the root word and apo is the prefix. I like apoptosis because it is descriptive, it's onomatopoetic as to what happens to the cells. So, however you want to pronounce it, I'm okay with it. So, our body is really exposed to a lot of potential harmful situations. And we have mechanisms in place to protect us from these situations and provide defense. So the cells can sustain injury by a lot of different mechanisms. Physical trauma, cuts, burns, pressure, all that good stuff. Chemical toxins, either from the inside, like medications, or from the outside, pollutants and environmental toxins, biological agents like bacteria and viruses, and we'll talk about some of those little baddies in chapter four. Hypoxia, just being deprived of oxygen. Our cells need a constant supply of oxygen in order to do their job. Temperature extremes. Our cells need to be in a pretty narrow range of temperature in order to do their job because of the cellular enzymes and other things that function in cellular metabolism only work in a narrow temperature band. Radiation, so that's from the sun or from other sources. We're constantly exposed to electromagnetic radiation and other types of radiation. And nutritional imbalances, the cells need nutrients in order to do their job. So the key point is that the body's response is going to depend on the magnitude and the duration of the insult. So cell damage can be divided into two main categories, reversible and irreversible. So reversible cell damage, the cells recover from it. And irreversible causes cell death. It ends in cell death. So reversible is if the stress to the cell is short duration or low in toxicity, the damage caused by any of the mechanisms of injury can be reversible. So, in reversible damage, the cell and some of its organelles can swell, and maybe the function is a little bit altered temporarily, but the nucleus remains unchanged. The nuclear material, the DNA, is protected, and the cell is able to recover and return to its normal homeostasis and function as it should. That's nice because this is always happening. With irreversible damage, sometimes the cellular stress is of a great magnitude or occurs over an extended period that leads to irreversible damage. And in this case, the organelles within the cell and the nucleus are damaged and cease functioning, damaged to the point where they don't work anymore. So the cell membrane can also be affected in irreversible damage. It's often destroyed and the cellular contents are dispersed, often causing damage to nearby cells. And that can cause the effects that we see as signs and symptoms of disease in our body. this kind of cell death is called necrosis, and the damaged cellular contents form substances called exudates that can accumulate in and around organs. And so we'll talk about some different types of necrosis with some really gruesome pictures. You gotta love that. So the exudate is damaged cellular material, and we'll talk about the different kinds of exudate at some point because different types of exudate indicate different things. So one type that we're probably all familiar with is pus. And so pus is infectious exudate, basically. It's the material that results from cell death by infection. There's sanguineous exudate, which has blood in it. There is serous exudate, which is just the clear fluid exudate. And there's fibrinous exudate, which means there's some clotting going on. So the different kind of exudate can often indicate the different types of injuries. So here are some examples of reversible versus irreversible. So reversible muscle fatigue during exercise, temporary reduction in function. Like you just did upper body, and your arms are trembling, and you try to like pick up a glass of water and your hands shaking. Temporary reduction in function. The cells will recover with rest, and there's no permanent damage. And in the case of exercise, a lot of times the cells will be better after the rest period, but you have to have that rest period. Irreversible, a good example of that is a heart attack or a myocardial infarction. The cells are deprived of oxygen for a prolonged period, and the cardiac muscles die. They experience necrosis, and usually coagulative necrosis, which we'll talk about in a minute, and you get permanent loss of function in the affected area. So in the case of a myocardial infarction, the long-term effects on the body have to do with how many cells die and how their function is affected. So if it's just a tiny little area, you're probably not going to have very many side effects. If it's a big area, you could die. So when bad things happen to good cells. So what happens during necrosis? During necrosis, the cell membrane actually ruptures and the contents are dispersed. So the cell contents being dispersed, all the enzymes and whatnot that are inside the cell and all of the chemical messengers and chemical contents of the cell can damage nearby cells. You get exudate, which is damaged cellular contents, and it triggers an inflammatory response, which we'll talk about in a little bit. So a critical idea for PTAs is that the areas of necrosis may be fragile and require modified treatment approaches. So if you have an area of cellular necrosis that is, especially if it's closer to the outside of the body, it might be more fragile and you might need to change your treatment approach. So the different types of tissues go through different types of necrosis. So the five types that we're going to talk about are coagulative, which is generally in the internal organs like heart, liver, kidneys. At a myocardial infarction or kidney damage, you get the coagulative necrosis, and we'll talk specifically what they are in the next couple slides. Caseous necrosis is typical of lung infections like tuberculosis. Liquefactive, it's brain tissue or wet gangrene. So gangrene is when bacteria invade tissues and cause tissue necrosis. So they talk about wet gangrene and dry gangrene. So with liquefactive, it's wet gangrene. Fatty necrosis happens in areas that are sort of fatty areas like the pancreas or with abdominal trauma. Fibrinoid necrosis, it happens to blood vessels. Each one has distinct characteristics and implications for healing. So with coagulative necrosis, the nuclei of the cells die, but the cell membrane remains intact, and so the cells coalesce. So when you have a heart attack, you don't get holes in your heart, you just get clumped together non-functional cells in the area. The tissue maintains its architecture initially. I mean, if enough cells die, then things go crazy. But for the most part, the tissue maintains its structure. So Dry gangrene in limbs is also classified as coagulative, although some sources list gangrene as a separate type of necrosis. Again, that's when bacteria invade an area and kill cells. Common locations for coagulative necrosis include the heart in a myocardial infarction, kidneys in a renal infarction, liver and dry gangrene. So the tissue may appear structurally intact, but it is non-functional. Caseous necrosis, which is also called cheesy necrosis, that is just gross. But characteristics of cheesy or caseous necrosis is that the cell membrane is destroyed and the contents of the cell become thick, creating a cheesy formation. That's why they call it that. That is, it sort of walls off those cells from the other cells in the area, which are called granulomas. That walled off area is called a granuloma. They persist for long periods, and so it's often associated with tuberculosis or other chronic lung infections where you get these walled off non-functional areas that are decreasing overall organ function because they're not working and they're taking up space. That's not good. So on a chest x-ray, you might see this with someone who has tuberculosis, and it definitely affects respiratory function. So with liquefactive necrosis, it's complete destruction of cells and all their contents, and it leaves pockets of liquid, and it's most common in the brain. The tissue architecture is completely lost. So with brain tissue is damaged in a stroke, there are other factors that contribute to this liquefactive necrosis, which we'll talk about more as we talk about strokes, and wet gangrene in infected extremities where the cells just liquefy and give you pockets of liquid. So you get permanent functional loss. And you need, with gangrene, a lot of times it results in amputation. And with brain infarctions, it results in requiring adaptive techniques. So it's liquefactive necrosis is not pretty. We'll just say none of this stuff is pretty. Fatty necrosis usually occurs in fatty tissues like the pancreas or the abdominal area. It can be as a result of acute pancreatitis or abdominal trauma, or trauma of breast tissue, trauma or surgery. Fatty necrosis forms white chalky deposits, which are calcium soaps, which form, and they're hard, palpable masses sometimes from fatty necrosis. So those hard, palpable masses might limit range of motion or cause pain with movement because they're hard and they're going to push on the tissues in the other area. So the other two types, fibrinoid necrosis is usually with blood vessels. And gangrene is sometimes considered to be part of different types of necrosis, but sometimes it's considered its own type of necrosis. And a lot of times gangrene requires tissue excision or amputation if it's gotten to that point. So apoptosis, or apoptosis if you prefer, is different from necrosis. It's a particular type of cell death, and we'll talk about the differences in a minute. But it's normal. It's the cells with pre-programmed cell death. Like there's certain cells, it's their time to die, and they do it. So it's a normal controlled process, and it does not induce an inflammatory response the way necrosis does. And there's no exudate and there's no damage to the surrounding cells. The cell itself just breaks into small organized units, and then it gets phagocytized by our cleanup cells, basically. So the purpose of apoptosis is to remove old or damaged cells, or and to maintain optimal cell numbers. So you don't want your heart to keep growing. It's called cardiac hypertrophy, and it's not a good thing. So if you maintain optimal cell numbers, your organs stay intact the way they're supposed to, and it preserves the organ function. So apoptosis is a normal part of healing and tissue remodeling. So when we talk about necrosis versus apoptosis, necrosis is normal I mean, it's not normal, it's pathological, and apoptosis is normal. It's supposed to happen. So, in necrosis, the cell swells and the membrane ruptures and the contents spill out, just ruining the neighborhood. So, damages the neighbors, and it triggers inflammation, and it's a disorganized process. It's not like an individual cell goes, okay, it's my time to go. I'm out of here. It's just wholesale damage. So I think of it as necrosis is the cells are like cars driving on the highway. Necrosis is there's a crash and there's stuff all over the place and it's disorganized and other cars might be involved. Apoptosis is one car exits the highway and everything goes along just fine. So with apoptosis, the cell, instead of swelling and rupturing the membrane, it shrinks and breaks into neat little packages, which can then be picked up by cleanup cells. The contents don't spill, so there's no inflammation, and it's an organized, controlled process. And it is controlled by some DNA signal that we don't really know what it is at this point in time. So apoptosis supports healing by getting rid of damaged or older cells, and necrosis complicates healing by damaging neighboring cells and disorganizing the tissues.